When you're in your 20s, hair loss can feel like a cruel joke. You're supposed to be in the prime of your life, young, energetic, full of potential, and yet, one morning, you look in the mirror and notice your hairline creeping back just a little. Maybe your once thick hair feels thinner. Maybe there's more hair in the shower drain than there used to be. And suddenly, a thought hits you. Wait, am I going bald already? This thought can be terrifying. Hair loss is often associated with middle age, not early adulthood. But here's the truth. Losing hair in your 20s is more common than most people realize. In fact, dermatologists estimate that around 20 to 25% of men start noticing the first signs of hair loss before the age of 21. And it's not just men. Many young women also experience thinning hair, especially during times of hormonal or emotional stress. So if you're in your 20s and noticing some shedding, don't panic. You're not alone, and it doesn't necessarily mean you'll go completely bald. In this video, we'll explore why hair loss happens so early, what's normal versus abnormal, the science behind it, and most importantly, what you can actually do about it. Let's begin by understanding the most common cause: genetics. 1. Genetic hair loss, the most common culprit. The medical term for hereditary hair loss is androgenetic alopecia, commonly known as male pattern baldness or female pattern hair loss. It's caused by your body's sensitivity to a hormone called DHT, short for dihydrotestosterone. Here's how it works. Testosterone, a natural hormone found in both men and women, is converted into DHT by an enzyme called 5-alpha reductase. For people who are genetically sensitive to DHT, this hormone gradually shrinks hair follicles, especially on the crown and hairline. Over time, these follicles produce thinner, shorter, weaker hairs until eventually they stop producing hair altogether. This process doesn't happen overnight. It's gradual. You might not notice much in a month or two, but over the course of a year or two, the difference becomes visible. In men, this usually starts with receding temples or thinning at the crown. In women, it often appears as overall thinning across the top of the head, while keeping the frontal hairline. So if your father, uncles, or grandfather started losing hair in their 20s or 30s, chances are high that you might follow a similar pattern. However, genetics aren't the only factor. 2. Stress and lifestyle. How modern life affects your hair. Your 20s can be stressful. You're juggling education, career, relationships, financial pressure, and often poor sleep or diet. All these can take a toll on your body and your hair. When you go through intense stress, whether physical or emotional, your body may enter a state called telogen effluvium. This is when a large number of hair follicles suddenly shift from the growth phase, anagen, into the resting phase, telogen. A few months later, that hair sheds all at once. The good news? Telogen effluvium is usually temporary. Once the stress resolves and your body stabilizes, new hair starts to grow again. But if the stress is chronic, like long-term anxiety, overwork, or poor sleep, the shedding can persist. Nutrition also plays a big role. In your 20s, many people don't eat balanced diets. Too much fast food, not enough protein, iron, zinc, or vitamins like B12 and D3, all can weaken your hair's structure and slow down regrowth. Remember, hair is made mostly of keratin, a type of protein. If your body isn't getting enough nutrients, it prioritizes essential organs first, and your hair takes the hit. 3. Hormonal imbalances and medical conditions. Another overlooked cause of early hair loss is hormonal imbalance. For men, it's usually related to DHT sensitivity. But for women, issues like PCOS, polycystic ovary syndrome, thyroid disorders, or birth control pills can dramatically affect hair density. The thyroid, for example, regulates metabolism and growth. If it's underactive, hypothyroidism, or overactive, hyperthyroidism, your hair growth cycle gets disrupted. Similarly, sudden changes in estrogen or progesterone, like after stopping birth control, pregnancy, or extreme dieting, can cause temporary hair loss. Even medications can trigger shedding. Drugs for acne, depression, blood pressure, or steroids may have hair loss listed as a side effect, so if your hair started thinning after starting a new medication, that might be part of the reason. 4. Lifestyle habits that accelerate hair loss. Let's talk about daily habits that can make things worse. Even if your genetics are perfect, poor lifestyle choices can speed up the process. Smoking is one of them. It constricts blood vessels and reduces oxygen flow to the scalp, starving your hair follicles of nutrients. Over time, this weakens your hair growth cycle. Alcohol and poor sleep also play a role. Drinking too often affects your liver's ability to metabolize hormones and toxins, and sleep deprivation raises cortisol levels, the stress hormone that can push more follicles into the shedding phase. Then there's hairstyling damage. Tight ponytails, braids, or hats that pull on the scalp can cause traction alopecia, which damages follicles over time. The same goes for harsh chemical treatments, bleaching, or using too much heat on your hair. It might sound like a lot to worry about, but understanding these factors gives you control. Because unlike your genetics, lifestyle habits can be changed. 5. How to know. If it's normal. So how can you tell if your hair loss is normal shedding or something to worry about? The average person loses 50 to 100 hairs per day. That's completely normal. It's just part of the natural cycle. But if you're losing more than that consistently, noticing visible thinning, or your hairline is changing shape, that's when it's worth paying attention. Early intervention is key. The sooner you identify the cause, the better the chance of slowing or reversing it. A dermatologist can perform a scalp examination, blood tests, or even a trichoscopy, a magnified look at your follicles, to find the root cause. In many cases, catching the problem early makes all the difference between minor shedding and long-term thinning. 6. Emotional impact. It's not just about hair. Let's be honest, hair loss isn't just a physical change. For many people, especially in their 20s, it hits self-esteem hard. You might feel older, less confident, or even unattractive. It's easy to start comparing yourself to others who seem to have perfect hair. But here's something important. Your worth isn't tied to your hair. Many successful, confident, and attractive people have experienced early hair loss, and they still live bold, fulfilling lives. The key is perspective. You can choose to fight it with treatments, accept it gracefully, or even embrace a new look entirely. What matters most is how you feel about yourself. Still, if the emotional burden feels heavy, it's completely okay to seek support, whether from friends, family, or even therapy. Hair loss anxiety is real, and you don't have to face it alone. 7. Early treatments that actually work now. Let's touch briefly on solutions, because yes, there are effective options. In the next part of this discussion, we'll dive deeper into treatments, but here's an overview. The most proven treatments for genetic hair loss are minoxidil and finasteride. Minoxidil is a topical solution that increases blood flow to the follicles, extending the growth phase of the hair cycle. Finasteride works internally by reducing DHT levels, which helps prevent follicle miniaturization. There are also newer treatments like microneedling, low-level laser therapy, and PRP, platelet-rich plasma injections, that stimulate the scalp. However, no treatment works overnight. It takes months to see results and requires consistency. Many people quit too soon and blame the treatment, when in reality, patience is the real secret. Let's continue right where we left off, with treatments and long-term strategies that can actually help you slow down or even reverse early hair loss. 8. Understanding the science behind hair regrowth. Before jumping into treatments, it's important to understand what hair regrowth really means. When people hear regrowth, they often imagine bald spots suddenly filling in like magic. But that's not how it works. Every hair follicle goes through three main stages. Anagen, growth phase, lasts 2 to 6 years. Catagen, transition phase, lasts a few weeks. Telogen, resting, shedding phase, lasts a few months. When a follicle is exposed to DHT or extreme stress for too long, it can shrink and produce thinner hairs. The goal of any treatment is to extend the anagen phase and reactivate dormant follicles before they permanently die. This means consistency is everything. Whether you're using medication, topical treatments, or natural methods, you must stick with it for at least 3 to 6 months before judging results. 9. FDA-approved treatments. What really works? Right now, there are only 2 FDA-approved treatments for pattern hair loss, minoxidil and finasteride, and both have solid scientific evidence behind them. Minoxidil, Rogaine. Minoxidil started as a blood pressure medication. Patients who took it noticed unexpected hair growth, and researchers realized it increased blood flow to the scalp. Applied topically, it helps bring oxygen and nutrients to the follicles, keeping them in the growth phase longer. It comes in 2% and 5% solutions, and both men and women can use it. You'll typically apply it once or twice a day to thinning areas. Results can start to appear after 3 to 6 months, but full improvement may take up to a year. However, consistency is non-negotiable. Once you stop using minoxidil, the new hair it helped grow will gradually fall out. So, it's a commitment, not a quick fix. Finasteride, Propecia. Finasteride works differently. It's an oral medication that blocks the enzyme 5-alpha reductase, preventing testosterone from turning into DHT. By lowering DHT levels in the scalp, it protects hair follicles from further miniaturization. Studies show that finasteride can stop hair loss in up to 90% of men and promote regrowth in around 60%. It's one of the most effective tools available for men dealing with early hair thinning. That said, finasteride is usually not prescribed for women of childbearing age due to potential hormonal effects. For men, it's generally safe, but can have rare side effects like decreased libido or mood changes. Most people tolerate it well, especially at lower doses. 10. New and emerging treatments. Science is evolving fast, and several new treatments are showing real promise. Microneedling. This involves using a small roller or pen with fine needles to create micro-injuries on the scalp. It sounds scary, but it's actually painless and triggers your body's healing response, releasing growth factors that stimulate dormant follicles. When combined with minoxidil, studies show microneedling can double its effectiveness. PRP therapy, platelet-rich plasma. In this treatment, a doctor draws your blood, spins it in a centrifuge, and injects the plasma, rich in growth factors, into your scalp. PRP helps improve follicle health and increase hair density naturally. It's popular among celebrities and athletes for its non-surgical approach. Low-level laser therapy, LLT. Devices like laser helmets or combs use red light to stimulate cellular activity in the scalp. This helps improve blood circulation and can strengthen thinning hair. It's FDA cleared and safe to use at home. Stem cell and peptide treatments. Although still experimental, researchers are exploring stem cell-derived serums and peptides that can rejuvenate aging follicles. These may become the next big thing in the next 5 to 10 years. 11. Natural remedies and lifestyle support. If you prefer a more natural or holistic approach, there are still plenty of ways to support healthy hair growth without prescription drugs. A. Scalp massage. Massaging your scalp daily for 5 to 10 minutes boosts blood flow and reduces stress hormones. You can use oils like rosemary, peppermint or castor oil, all shown in studies to improve hair thickness over time. B. Nutrition and supplements. Hair needs raw materials to grow strong. Focus on a high-protein diet, including eggs, fish, lentils and nuts. Also, make sure you're getting biotin, vitamin B7, supports keratin production. Vitamin D, low levels are linked to hair loss. Iron and zinc, essential for follicle health. Omega-3 fatty acids, reduce inflammation and improve scalp health. Many people in their 20s skip meals or eat mostly processed foods, leading to subtle deficiencies. Sometimes, simply fixing your diet can dramatically reduce shedding. C. Stress management. As we mentioned earlier, chronic stress is a silent hair killer. Meditation, exercise, yoga, or even spending time outdoors can help lower cortisol levels. Reducing stress is not just good for your mind. Your hair literally benefits from it. D. Sleep. Never underestimate the power of sleep. Growth hormone, which plays a role in hair regeneration, peaks during deep sleep. Aim for 7 to 9 hours per night. 12. Myths versus facts about hair loss. Let's clear up some common misconceptions that confuse people in their 20s. Myth 1. Wearing hats causes baldness. False. Hats done to make you bald, unless they were extremely tight and pulling on your hair constantly. Myth 2. Washing your hair too often causes hair loss. Not true. Shampooing doesn't affect follicle strength. You only see hair fall because those strands were already ready to shed. Myth 3. Hair loss only comes from your mother's side. Partially false. While the gene for DHT sensitivity can come from the X chromosome, which you inherit from your mother, research shows both sides of the family can contribute. Myth 4. Once you start losing hair, there's nothing you can do. Completely false. Early detection and consistent treatment can absolutely slow, stop, or even reverse hair thinning for many people. 13. When to see a specialist. If you're in your 20s and unsure what's causing your hair loss, it's smart to consult a dermatologist or trichologist. They can examine your scalp for signs of inflammation or pattern loss, order blood tests to check for thyroid issues, vitamin deficiencies, or hormonal imbalances, and recommend a tailored treatment plan based on your specific condition. Remember, hair loss isn't a one-size-fits-all issue. Two people with similar thinning may have completely different underlying causes. 14. Building a hair-healthy lifestyle in your 20s. Here's something empowering. Your 20s are actually the best time to take control. Why? Because you can still prevent major loss before it's too late. Once follicles are gone, regrowth becomes much harder. But if you act early, you can maintain your hair for decades. Here's what that looks like in practice. Eat a balanced diet, rich in protein and micronutrients. Avoid excessive alcohol, smoking, and lack of sleep. Manage stress through exercise or mindfulness. Use gentle hair care. Avoid harsh chemicals or constant heat styling. Stay consistent with your chosen treatment, whether natural or medical. Think of it like fitness. You wouldn't expect abs after 1 week at the gym, right? The same applies here. It's about long-term commitment. 15. Acceptance and confidence. Let's take a moment to talk about acceptance, because while there are many ways to treat hair loss, it's equally powerful to accept it and still feel confident. Look at public figures like Jason Statham, The Rock, or Stanley Tucci. They've all embraced baldness and built iconic looks. What made them attractive wasn't their hair, it was their confidence. When you carry yourself with pride, no one cares what your hairline looks like. So, whether you choose to treat it, manage it, or embrace it, remember, it's your choice. Don't let hair define your identity. You're more than your reflection in the mirror. 16. Final thoughts. Hair loss in your 20s can feel unfair, but it's not a life sentence. In most cases, it's manageable, and sometimes even reversible. The key is to stay informed, act early, and stay consistent. To summarize everything we've discussed, hair loss in your 20s is surprisingly common. Genetics and DHT are major factors, but stress, diet, and hormones also play roles. Minoxidil and finasteride are scientifically proven to work, while natural approaches like nutrition, scalp care, and stress reduction help support results. Early action makes the biggest difference, and most importantly, your self-worth goes far beyond your hair. So if you're watching this right now and noticing early signs, don't panic. You're not broken. You're not alone. And you have options, real science-backed options that can help you feel like yourself again. In the end, hair loss is just another challenge that life throws at us in different forms. But like every challenge, it can either define you or refine you. The choice is yours.